Good afternoon, everyone. In last lecture, we discussed about recent symptoms and old symptoms. So, what is recent symptom? Recent symptoms are those which have surfaced or are available as a later development in chronic case. This division is done on basis of time and progress in chronic disease of long standing. Recent symptoms that indicate the trend and the direction of the forward movement of the disease means is the disease is in at what stage the disease condition is it curing the in the direction of cure, or it is in the direction of worsening the condition of the patient. So with the help of the recent symptom, we can able to decide what is, or we can able to find out what is the trend of the disease is, or what is the how the disease was, is it progressing, or is it recurring at recurring stage, and therefore they should be given due to importance while selecting a simillimum. And as these recent symptoms, they show the trend as well as the direction of the movement of disease, so they help us in selecting a simillimum, and so it has given importance while taking the case. These symptoms also be considered, because with the help of these recent symptoms we can able to understand the trend of the disease. Then old symptom. Old symptoms are those which give a clue about the beginning of a chronic disease. They are not easily available in most of the cases due to lack of observation and understanding the significance on the part of the patient. So, what are the old symptoms? The symptoms when the disease commences, or when the patient falls from healthy state into the disease state. At that time, the symptoms which we observe, the symptoms which the patient give, these symptoms are nothing but the old symptoms. And how the disease condition starts, how it progresses. With these symptoms, we can able to understand the progress of the disease, or how the beginning of the disease, which or how the disease begins. They are not easily available in most of the cases due to lack of observation and understanding the significance on the part of the patient. So many times what happen, these symptoms, as the patient cannot understand the significance of these patients, the these symptoms, as well as the importance of these symptoms. So they cannot give importance to these old symptoms, as well as many times there may be lack of observation, as well as if in chronic condition the disease is prolonged. So due to prolonged disease condition, the patient cannot remember each and every symptom which, or each and every symptom at the beginning of the disease stage. So these are the problems. So many times these old symptoms, we cannot get these old symptoms properly. old R help the physician to understand the original unmodified picture of the disease symptom. And these symptoms, why these symptoms are important? Because these symptoms help to understand what is the unmodified picture of the original unmodified picture of the disease. Because what the today's or what is the present stage of the patient, the symptoms or the present stage of the disease, it may be due after the symptoms which are present. These may be the symptoms after different type of medications. So there is mixed disease condition or mixed symptoms. It may be the original disease symptoms plus some medicinal symptoms we get. So to get the original unmodified picture of the disease, what is exactly the original disease of the patient, to get that picture, these old symptoms are very much helpful. Then nomenclature of symptom. In homeopathy, we came across a different names of the symptoms which are as follows, that is pathognomic symptoms. What is pathognomic symptoms? Specific and characteristic symptom of a given disease or clinical condition are called as pathognomic symptom. So what is pathognomic symptom? These are nothing but the symptoms of the disease. So pathognomic symptoms are nothing but the characteristic symptoms of the given disease or the clinical condition. So what are the symptoms of the disease? What are the symptoms of the clinical condition, whatever the patient is suffering? These symptoms are nothing but the pathognomic symptoms. These symptoms are also known as pathognostic symptom. So many times in oral examination, to confuse the students, many times the examiners may ask what is pathognostic symptom. So you should know what is pathognomic symptom and pathognostic symptom. These are the same the same type of symptom, and these are nothing but the symptoms of the disease or symptoms of the clinical condition through which or from which the patient or the person was suffering. Then determinative symptom which help to find out or select finally an indicated remedy are called determinative symptom. What is determinative symptom? So these are the symptoms which help us to find out or select finally an indicated remedy. This term determinative symptom, it was used first by Dr. Garth Borick. So it is also called as Borick's determinative symptom, and it is or these symptoms are equivalent to Kent's characteristic symptom. So as according to Dr. Kent, the characteristic symptom of the patient, these symptoms are also called as PQRS symptoms according to Dr. Boni Hussain, and these symptoms according to Dr. Garth Borick, it is called as determinative symptoms. Means these symptoms which help us to find out or to select a simillimum from group of similars. So which symptoms are we use for selecting the final simillimum? These symptoms are called as determinative symptom. And this determinative symptom, this term is used by Dr. Garth Borick. So these symptoms are also called as Borick's determinative symptom. Then basic symptom. Symptoms which are essential for understanding the disease condition and are found in almost all prover without any characteristic are called basic symptom. Means in any disease condition which symptoms are common in all provers, these are called as basic symptoms. They are equivalent to common symptoms. As I told just now, these are nothing but the common symptom of the disease, and in drug proving or in that disease condition, most of the provers or most of the patients, they give these common symptoms. So these are called as basic symptom, and they are also called as generic symptom. So the generic symptom, basic symptom and common symptom, they are nothing but the same concept. So these are the symptoms which are common to that disease condition, and we cannot found any characteristic in these symptoms. So these are called as the basic symptom of the disease, a common symptom of the disease. Then diagnostic symptom. What is diagnostic symptom? The symptom with which we can able to diagnose the disease condition. So the symptoms which are important for diagnosing case are called diagnostic symptoms. The symptoms with which we can able to diagnose the disease condition, these symptoms are called as diagnostic symptoms. These symptoms are the product of a disease, and they are helpful and they are not very helpful in in homeopathic prescribing, because we cannot use the diagnostic symptoms. As all we know, we while prescribing homeopathic medicine, we cannot prescribe according to the disease diagnosis, according to the clinical condition, whatever the patient was suffering, but we have to consider the patient as a whole. So these diagnostic symptoms, the symptoms whatever we get which are useful for the diagnosis of the case, for the diagnosis of the disease, these symptoms are the product of disease and not very helpful in homeopathic prescribing. They are also known as ultimate pathological and common symptom. So these symptoms are also known as ultimates or pathological symptom or common symptom, because these are the symptoms of the disease and with which we can able to diagnose the case. So these are called as the common or diagnostic symptoms. So the diagnostic symptoms are the common symptoms of the disease. Sorry. So the diagnostic symptoms are the common symptoms of the disease, and these symptoms, while when we are going to prescribe according to, or when we are prescribing homeopathic medicine, then these symptoms are not useful symptoms, or we cannot use these symptoms for selecting the simillimum, because as we are considering the patient as a whole, not his disease, not his clinical condition, not his part or organ which was suffering. So these symptoms are also known as the ultimates, pathological or common symptoms of the disease. Then negative symptom. The symptoms which are expected to be present in a case but remain absent are called negative symptoms. Means we expect in this patient, in this condition, the patient, whatever the condition the patient was suffering, in that condition of the patient, we expect some symptoms, but if these expected symptoms are absent, then these symptoms are called as negative symptoms. And for example, absence of thirst in fever, or absence of pain in inflammation. So in fever there is dehydration, so there must be, the patient must be thirsty. But if there is absence of thirst, though the patient was suffering from fever, then it is unexpected symptom. In absence of thirst during fever, this is unexpected symptom and it is called as negative symptom. Or if there is inflammation at any part, on any part of the body, if there is inflammation, and though there is inflammation, there is the no pain, the patient, when we ask about the pain, the patient express that there is no pain. So in inflammatory condition, if there is absence of pain, then it is also not expected, and this is also a negative symptom of that case. Then accessory symptom. Accessory symptom means a long standing symptom which the patient thinks is a part and parcel of its normal functioning. It's called as an accessory symptom. These are important symptoms for homeopathic prescription. So what are accessory symptoms? These are the symptoms which are present with the chief complaint, and as these symptoms are present since a long time, so the patient think that this is not the symptom, but this is part and parcel of his normal functioning. For example, if normally the bowel habit, it should be 2 times, and if the patient, there is the patient felt need after eating anything, if the patient felt go to, or patient, if he feel after eating everything the patient go to the motion pass, then this is the, and this is since long time, since childhood, after eating anything the patient has to visit to the toilet, and this symptom is since the patient was 3 to 4 years old. and now the patient is 50 years old, but this is the habit since his childhood. So he think that that was not the symptom because it was long standing, and according to patient this is the part and parcel of his normal functioning. So this is called as accessory symptom. And as these symptoms, though they are present since long duration, and the patient cannot express, the patient don't know the importance of that symptom, but we have to collect these type of symptoms because they are very important symptoms for prescribe the homeopathic medicine. So to prescribe the homeopathic medicine, these symptoms are very important symptoms. So we have to collect such symptoms while taking the case. Then keynote symptom. The keynote symptom, all we know about the keynote symptom, the symptom which are peculiar in a case and help to find out small group of remedies are called keynote symptom. Means these are the symptoms which are peculiar to the case. These are symptoms which are uncommon in the case, and they help to find out a small group of remedies out of our large or huge materia medica. We can able to find out a small group of remedies with the help of this keynote symptom. There should be at least 3 keynote symptoms in order to make a correct homeopathic prescription. So in a case to make a correct homeopathic prescription, we cannot prescribe according to one symptom, but we have to consider 3 symptoms, and then we have to select the similimum. It was Dr. Guernsey who highlighted the importance of these symptoms in homeopathic practice. Later, many other great prescribers like Dr. Lippe, Dr. Well, Dr. Allen, they gave importance to keynote prescribing. So the keynote symptoms, these are especially helpful in acute condition, because during acute condition with the help of these keynote symptoms we can easily find out the similimum within short period, because in acute condition of the patient there is less time, and within less time we have to find out the exact similimum. So to find out the similimum, such symptoms which will help us to find out a group of similar remedies, or which are help us to find out the similimum, these symptoms are definitely helpful in especially in acute cases. And these symptoms, they are first time highlighted by Dr. Guernsey. Later, many homeopaths that like Dr. Lippe, Dr. Well, Dr. H.C. Allen, they gave importance to keynote prescribing. Then eliminative symptom. The symptoms which help to eliminate some unimportant medicine to facilitate the selection of the similimum are called eliminating symptom. the symptom which help to eliminate some unimportant medicine. Means with the help of these symptoms, we eliminate, we we can remove the unimportant medicine, or we can select the important medicine to find out the exact simillimum out of those. So the symptoms which help us to find out the exact simillimum by eliminating some unimportant medicine, these are called as eliminating symptoms. These symptoms are best to start with in repertorizing a case. So these symptoms are helpful especially when we are starting or when we are going to repertorize the case. Then by selection of such eliminative symptom, it was easy for us to find out the group of similars and out of that the exact simillimum. One should be very careful in selecting a symptom to be used and an eliminative symptom. So as these symptoms, they help us to find out the group of similars, or they help us to find out the simillimum. So while selecting the eliminative symptom, the physician or the homeopath who was selecting such symptoms, he should be very careful while selecting such symptoms. Dr. M. Tyler introduced these symptoms in repertorization. So, these symptoms are introduced by Dr. Tyler in repertorization. So, remember the symptoms which help us to eliminate some unimportant medicine to facilitate the selection of simillimum. These symptoms are nothing but the eliminating symptoms. Now, determinative symptom. So, what is determinative symptom? The symptom which help to find out or select finally an indicated remedy are called determinative symptom. This term was also used first time by Dr. Kat Borik. So it is also called as Borik's determinative symptom, which is equivalent to Kent's characteristic symptom. So the determinative symptom and characteristic symptom, it is nothing but the same, and these are help us to find out the or select the final remedy, final simillimum. So these symptoms are called as determinative symptoms according to Dr. Borik, and characteristic symptom according to Dr. Kent. Then basic symptom. The symptoms which are essential for understanding the disease condition and found all provers without any characteristics are called as basic symptom. Sorry, these slides, I think it was bit repeated. Okay, so these symptoms are also called as common symptoms or generic symptoms or disease symptoms. Then diagnostic symptoms, this is also we have completed, that is the symptoms which are important for diagnose the disease condition. These are called as diagnostic symptoms, and these symptoms are the product of a disease and not very helpful in homeopathic prescribing. They are also known as ultimates, pathological, and common symptoms. Negative symptoms. Symptoms which are expected to be present too in a case but remain absent are called negative symptoms. So what are negative symptoms? The symptoms which we expect in the case but we cannot found, as I told you, discussed earlier, that is the examples are absence of thirst, absence of pain in inflammation. These are the negative symptoms. Then accessory symptoms. The patient thinks that these symptoms are nothing but a part and parcel of his normal functioning. These are called as accessory symptoms. Then alternating symptoms. The symptoms which manifest the partial picture of a chronic disease in one phase and are replaced by some other manifestation later are called alternating symptoms. So, what are alternating symptoms? These are the symptoms which manifest the partial picture of chronic disease in one phase and are replaced by some other manifestation later are called alternating symptoms. Knowledge of these symptoms help us to obtain the complete picture of chronic disease. So these are the symptoms which manifest